Welcome back to Black News Tonight. Let's see what's happening in the digital streets. Taraji P. Henson opened up to Women's Health magazine about making mental and physical health changes after doctors warned that she was at risk for developing stomach cancer. Henson also tells the outlet that she knew that she had to do everything that she could to feel good or her depression would sink her. Henson has been outspoken about mental health, speaking to our very own Mark Lamont Hill. Take a listen.
Watch us discussing important topics that affect our mental. Not only discussing it, but having clinicians, professionals, psychiatrists, therapists to come on the show and give us tools to help us cope in a healthy way, and to also give proper definitions and to terms that we have just never discussed.
And joining me now to help break things down is Jane Marks, mental health and wellness correspondent for BNC. Welcome back to Black News Tonight. Now, Jane, how important is it that celebs like Taraji are opening up about their mental health journeys, especially in the Black community?
It is so critically important because you know what it does for the rest of us? It gives us permission to talk about our own concerns. When they put language on their feelings, then we are willing to talk about the experiences that we've been through. And when they say that they've gone to seek help, then guess what? We're going to also make that decision too. Because you know what? When you realize that you're not by yourself, it gives you permission to move forward. So I think it's great.
Yeah. Taraji also revealed to Women's Health how the COVID-19 pandemic really tested her, including briefly abandoning her holistic diet. What are some ways that we can stay mentally fit even during the pandemic?
You know, it's interesting to me, Aisha, when my patients come to me, I give them a list of things that have just held true for years and years, because I've been in practice for a long, long time. But I always start with movement. 45 minutes of cardio every single day, not just, and particularly if you're going through a mental health crisis. Your diet is important. Protein, at least 15 to 20 grams 3 times a day. We talk about meditation and giving up on substances that typically you use to self-medicate. Alcohol and caffeine. We love to load up on caffeine, and yet caffeine exacerbates anxiety. Meditation and mindfulness. All of these things are things that Taraji talked about when she talked about strategies. And you know what? When we have patients that come in and we put them and we give them a plan, we see improvement in functioning, and a lot of times without therapy. They just have to go into mindful self-care.
Everything that you're talking about sounds like stuff that I wasn't taught in my family, and I wonder how we break generational curses, and actually when we reach this state of healing, how we can remain consistent with all of these practices.
You know, when you talk about remaining consistent, we do a lot of teaching, at least you certainly when I'm working with patients, and let them know that, you know, your mental health is a continuum, and depending on what's going on in your life, as long as you're taking fairly good care of yourself and there's not a significant history of depression in the family, then you're going to be able to manage the demands of the day, because that's what good mental health is. We're able to manage the demands of the day. We have basically a peaceful mindset. We're able to practice stress management and to meet conflict, you know, head on. And so taking care of yourself is a critical part of it. You don't just stop. You know, once you take care of whatever the mental health episode is, you continue to take care of yourself on a regular basis.
Well, I am already feeling a spirit of healing, and Jane, I so appreciate you coming on and sharing your insightful comments on this important topic. Thank you so much. We appreciate you at Black News Tonight.